Your mental health is everything. Prioritize it. Make the time like your life depends on it, because it does. Good morning. My name is Carl Bauer. I'm here today to discuss bipolar disorder in adults, a global health mental issue. My presentation today will provide a background of problems, system thinking, and dynamic system theory, how system thinking, theory, and model are utilized to improve bipolar disorder, and 3 initiatives to address bipolar disorder. Skills needed by public health leaders will also be discussed. The references of the study and conclusion will be presented. Now let's move to the problem and situation. The World Health Organization reported that in 2019, approximately 1 in 150 adults live with bipolar disorder. That's approximately 2.4% of the global population are affected by bipolar, which is associated with cognitive impairment, reduced functioning, and decreased quality of life, which is a recurrent lifelong disorder. The incidence of bipolar disorder amongst young adults and adolescents increased globally from 79.2 in 1990 to 84.9 in 2019. Now, the bipolar disorder contributes to global disability due to early onset, remitting and relapsing course, and impacts on employment, education, and cohabitation. Bipolar disorder increases mortality, especially by death by suicide in young people, and is one of the leading causes of disability. Why is bipolar disorder important for global health? Bipolar disorder causes severe damage to psychological, social, and physical functioning of young adults and adolescents. There has been an increase in prevalence, incidence, and years lived with disability over the last 3 decades in both females and males. A person with bipolar disorder has a lifetime risk of suicide attempt of 29.2%, compared with 15.9% for someone with a unipolar condition. Worldwide, the treatment coverage for people with bipolar disorder is low. Both men and women are often misdiagnosed. Many lack access to services and recommended interventions, especially in low and middle income countries. Why is a system thinking model crucial for this complex issue? Bipolar disorder involves recurring depressive and hypomanic episodes. The temporal nature of bipolar disorder has inspired the conceptualization using dynamic system theory modeling, which is a mathematical framework of understanding systems that evolve over time, making it a conducive framework for modeling and studying time-varying aspects of bipolar disorder, as you can see. Dynamic systems modeling captures the relationship between a feature of interest of a system and an evolution rule that describes how those features change over time. So how can systems thinking and dynamic systems modeling help to understand why bipolar disorder is a global health issue? Dynamic systems modeling approaches can be used to mathematically describe theoretical mechanisms of bipolar, such as reinforcement learning, linking affective dysfunction to abnormalities of the behavioral activation system and neuroanatomical circuits governing emotional processing or circadian function. Moreover, a hybrid approach should be used in future modeling studies that first operationalizes bipolar disorder features of interest using data empirically to achieve face validity, followed by hypotheses of those features using generative models with components that are homologous to psychological or physiological systems involved in bipolar disorder to achieve a valid construct. Now, here's some of the system thinking tools and applications. Dynamic system modeling studies in bipolar disorder must distinctly identify the comparators and conditions of interest and the attributes that define them. Now, review of dynamic systems models of bipolar disorder use a valid novel approach guide for computational models derived from animal model literature. There is a need for longitudinal studies of bipolar disorder to use multimodal data collected such as mood ratings, physiological signals, passive sensing, and ecological momentary assessment methods. How can systems thinking models be utilized to improve bipolar disorder? So dynamic systems modeling is used to predict and describe interactions over time between multiple components of a phenomenon that are considered a system. Therefore, we need to define ground truths concerning the nature of bipolar disorder by considering dynamic systems modelling of bipolar disorder in a structured fashion, where a disconnect has been identified between theory-driven and data-driven approaches used in bipolar disorder modelling literature. By developing psychologically or biologically homologous models of the bipolar disorder phenotype, we will improve our understanding of how the brain develops this severe condition and how its management can be improved. The importance of a dynamic systems modelling is that it allows researchers to investigate communication phenomena at various levels that might not be appreciated in survey research or easily manipulated in experiments. Analysing bipolar disorder through a connectomics lens position of earlier studies of functionally localised disturbances into broader network and circuit mechanisms that integrate affective cognitive control and reward systems of the brain. A blended approach that combines the strengths of both theory and data-driven methods will ensure feature model generates results that can be empirically verified, adequately explain behaviour in bipolar disorder, and provide mechanistic insight into bipolar disorder through homology with psychological and biological systems. Dynamic systems modelling will improve understanding and management of bipolar disorder and assist to remove social stigma associated with this condition. More resources need to be made available to access earlier diagnosis and timely interventions, including treatments. There are a range of effective care options which combine pharmacological and psychosocial interventions to help people with bipolar stay well. However, 3 initiatives and programs to address bipolar disorder need to be implemented into practice. So firstly, an integrated care model involving the coordination of primary care with mental health services to ensure that individuals receive comprehensive care addressing both mental and physical health needs. This model usually includes medication management, monitoring and therapy. Secondly, community-based mental health programs provide local resources which are accessible for people with bipolar. These programs provide counselling services, outreach programs to reduce stigma, support groups and promote mental health awareness. Finally, telepsychiatry services involve using telecommunication technologies to provide mental health assessment and care. This can involve remote monitoring, video consultations and online therapy sessions. Now, people with bipolar disorder should be treated with respect and dignity and should be meaningfully involved in care choices, including through shared care, decision-making regarding treatment and care, balancing effectiveness, side effects and individual preferences. Stop stigma. To achieve the optimum goals for improved global mental health, leadership skills are needed to influence decision makers and impact policy and prioritise public health initiatives as follows. So effective communication is required to articulate ideas concisely, clearly and persuasively to various stakeholders. Evidence-based advocacy facilitates using research and data to support arguments and demonstrate the impact of proposed initiatives. Leadership and influence to motivate and inspire others to take actions towards a shared goal, mobilising communities. There are 6 key components of public health leadership, as you can see in this picture. Now, here is the reference list of this study. In conclusion, bipolar disorder is associated with significant disability and difficulties in many areas of life. Many people with bipolar disorder are misdiagnosed or untreated and experience discrimination and stigma. Systems thinking provides a way for society to address this growing problem and how to identify and support those individuals affected by bipolar disorder and other mental health problems. Dynamic systems modelling provides the tools for innovative research, understanding and management of bipolar disorder. Addressing bipolar disorder requires effective leadership involving all the stakeholders collaborating in effective interventions in identifying families at risk of having bipolar children and early identification through screening and being adequately resourced interventions such as community-based mental health integrated programs and telepsychiatry services. Now, leadership skills needed are multifaceted and can be developed in various individual stakeholders to work collaboratively and as an effective community team for the benefit of those affected by bipolar disorder and supporting their carers and community. You don't have to struggle in silence because your mental health matters. Thank you very much.